Alright everyone, so in this video we're going to be covering how Probenecid works in the kidney, why is it different from Allopurinol, and who should and should not receive it, why renal function matters, and especially how it can trigger early gout flares. So we're also going to be talking about the kidney stone risk, major drug interactions like aspirin and penicillin. Okay, so let's just start with this. Alright, so Probenecid belongs to the uricosuric class of anti-gout medication. The word uricosuric is the clue, right? It means medication that helps move the uric acid out through urine. Okay, so this is different from allopurinol. Allopurinol lowers uric acid production. Probenecid will be increasing the uric acid excretion. Probenecid acts in the renal proximal tubule of the kidneys. So normally the kidney filters uric acid into the urine, but then a transporter called URAT1 reabsorbs some of that uric acid back into the bloodstream. So Probenecid just blocks that reabsorption. So instead of uric acid returning to the blood, more uric acid stays in the urine and leaves the body. Serum uric acid goes down over time, and this helps prevent future gout flares, and it helps reduce also the urate deposits. Okay, a good memory phrase would be like allopurinol turns down uric acid faucet, Probenecid opens the kidney drains. Okay. Alright, sorry, I had an issue with the camera. Probenecid is used for chronic gout management. Alright, it's not for rescue medication for sudden gout pain. The goal is more like a long-term control by lowering serum uric acid over time. Probenecid will be helping future gout attacks and may help tophi shrinks gradually. What is a tophi? The tophi is just those small firm uric acid deposit that can appear around joints or soft tissue after long uncontrolled hyperuricemia. The renal rule is the biggest testing point. Probenecid needs working kidneys because the drug depends on renal filtration or renal excretion. So, in short, if the kidney function is poor, then the drug may not work well, and the patient is at higher risk for complications. Before giving it, then you're gonna have to assess for serum creatinine, glomerular filtrate rate, or creatinine clearance, any history for kidney stones, and serum uric acid levels. I will say that in moderate to severe chronic kidney disease, especially chronic kidney disease stage 3 or worse, allopurinol or another xanthine oxidase inhibitor is usually preferred. Now, do not think of Probenecid as the best choice for every gout patient. It's mainly more for patients who need to lower the uric acid levels, okay, and still they still need to have adequate renal function. All right, so one of the easiest NCLEX traps is confusing maintenance therapy with acute gout treatment. Probenecid does not treat the acute gout pain because it's not an anti-inflammatory. Acute gout pain is caused by inflammation around uric acid crystals in the joint. So for the acute inflammation, the provider may use medications such as non-steroid anti-inflammatory drugs, colchicine, or even corticosteroids. Now, Probenecid can also trigger gout flares when therapy is first started because changing uric acid levels can mobilize uric stores, the urate stores from one place to another. So for that reason, anti-inflammatory prophylaxis such as low levels of colchicine or non-steroid inflammatory drugs can be appropriate, okay? So they might be ordered in the first months of therapy. Now, the other major danger is, okay, that sounded good. The other major danger is kidney stones. All right, it makes sense. Why? We have uric acid, we have crystals that's being sent to be filtrated in the kidney. So they can crystallize in the kidney and they can turn into little stones. Okay, so nursing teaching here is direct. The patient needs to drink plenty of fluids, follow the prescribed plan for any urine alkalinization if ordered, or they should report any flank pain, which is like the pain that they have in the back here, or like close to the kidney area. They should report any blood in the urine, painful urination, or any signs of renal colic. The final Probenecid points are interactions and discharge teaching. The aspirin interaction is high-yield topic. Salicylates can block the uricosuric action of Probenecid, so the gout medication becomes less effective. What does that mean in simple short words? Do not mix aspirin and this medication. Patients should not self-treat pain with aspirin unless the provider especially tells them to do so. And for minor pain, acetaminophen is often more like a preferred alternative. But the patient should still follow the provider instructions, okay? So it's like they usually say in nursing school, oh, you're just a nurse. They have no idea. But you know what I mean. Probenecid also decreases the renal secretion of penicillin and some of their beta-lactam antibiotics. So this can raise and prolong antibiotic levels in the blood. Sometimes this is intentional, but it can also increase the risk for adverse effects. So medication reconciliation, as always, it always matters. Now, teach the patient to take Probenecid consistently, like every single day or whatever the doctor says. It's like consistency, as in any other medication that's for prevention, you cannot stop taking it. So ideally take it with food or milk. If it causes any stomach upset, they should drink enough water, again, to keep the urine diluted. And they should follow any orders for sodium bicarbonate or potassium citrate if urine alkalinization is needed. Now, diet teaching still matters. They should reduce the high purine triggers such as organ meat, certain seafoods, and beer. I mean, beer is never good for a patient, so that's kind of easy to remember. Also, teach the patients to report rash, fever, sore throat, unusual bruising, bleeding, the flank pain, or any blood in the urine. So for the test, remember the clean comparison. Allopurinol is going to be blocking the production. Probenecid is going to be pushing the uric acid throughout the body, outside of the body, through the kidneys. Make sense? Bro, don't forget to subscribe. I know this is a new channel, but I'm going to be doing my best. Don't forget to subscribe. Give me a thumbs up if it was helpful for you. And good luck in nursing school. I know it's hard, but don't say. I think it's better to even say it's not hard. It's hard to manage it, but you can do it. I believe in you.